Okay, I'm at my medication MAR for my patient Martha May. I'm in an uninterrupted zone and I'm gonna look at what's available and what I need to get. So first on her MAR is fluoxetine, 60 milligrams by mouth every morning. I'm gonna look at my fluoxetine, check expiration date, and note that I have 20 milligram capsules. So if I need 60 and have 20, I'll have 60 over 20 times 1 capsule and have 3 capsules to give. And I'll confirm that with my second nurse. I'll get some hand sanitizer on with some gloves, and again note that I need fluoxetine, 60 milligrams, and I will count with 20, 40, 60. And put that in a medication cup container for her to administer. All right, so I checked that twice. I'll check a third time at the bedside. We got her insulin next. Her insulin NPH 10 units, her Lispro 2 units. I'm going to mix my NPH because it is cloudy. And I'll especially have a nurse while getting this insulin prepared because it is a high alert medication. I'm cleaning those for 10 seconds. Okay. Alrighty, we're going to prepare the cloudy first, which is my NPH 10 units. So I will get it at 10 units, confirm that that's where it is with my second nurse. My NPH is cloudy, okay. Insert the air, take it out, then get my 2 units of Lispro. Confirm that with my second nurse. Be careful because it's an open needle. As best as you can see that, 2 units and 2 units of Lispro. Also checking expiration date for my Lispro and NPH. All right, so we're gonna get 2 units of this Lispro. And be careful because there's some bubbles. Okay. Be careful because that came out, so I would want to have had it up like this and then taken it out. Okay, and confirm that with my second nurse at 2 units, and confirm with you that it's 2 units. All right, now I have my NPH. And I will draw this up to 12 because it will be a total of 12 units, but we're getting 10. Okay, confirm that with my second nurse. I can also cap this. Get a bubble out. Alright, confirm with you that that is 12 units total for her insulin, and confirming that with my second nurse. Okay, so that is for fluoxetine. This is her insulin NPH 10 units, her Lispro 2 units. Alright, we're gonna combine some medications now for ceftriaxone. And what we have available is 1 gram, but we're gonna reconstitute with 2.1 milliliters of sterile water or lidocaine. I'm gonna use sterile water because that's what I have available. But before I go any further, I'm going to complete my math and confirm with my second nurse. So 2.1 milliliters is what I'm gonna inject, and then after that, each 1 milliliter has 350 milligrams. Okay, so that's what I have, but I'm to give 0.1 grams, 0.5 grams. So we'll convert grams to milligrams by multiplying that by 1,000, which will be 500 milligrams. Okay, so I need a calculator. Does someone have a calculator on hand? By chance? Thank you. Okay. So 500 divided by 350 is 1.428574143. And we're going to have that times by 1 milliliter, which will round to the nearest tenth, which will be 1.4 milliliters, which is what I will administer to my patient. All right, thank you. I'm also confirming that with my second nurse, doing math together or separately to make sure it's correct. Okay, let's get this cleaned for 10 seconds on each vial, checking expiration date. This is my ceftriaxone for her UTI. Clean for 10 seconds. Okay. Alrighty. I'm going to get this in, making sure that it's kept clean and sterile. Okay, so we need 2.1. So we're going to get this air drawn up at 2.1. My second nurse with you at 2.1. Okay. And drop up 2.1. Be careful that I have an open needle. Drop back a little bit, get those bubbles out. I can give this over garbage can. All right, confirm that with my second nurse. And confirm it with you here. Okay, at this point, I'm going to put a safety on, but I'm gonna recap it, being careful, because I would like to drop up with the medication. And we're gonna mix. Okay, so again, looking at ceftriaxone, that's what I have. Expiration, this is all going according to plan of how I need to administer and prepare. This is also gonna be, I'm gonna apply a large gauge needle with a 1.5 inch length, and I have an 18 gauge needle. And noting that it is mixed. Okay, we're gonna clean this top vial again to be clean for 10 seconds. All right, I confirmed my math with my second nurse. I'm needing to get 1.4, 1.2, 1, 2, 3, 4. Okay, I'm gonna confirm with my second nurse, confirm it with you here. Okay. I'll put safety on, but to preserve my supplies, I'm gonna keep it on just for a moment. Get those bubbles out. All right, confirm that with my second nurse and confirm with you here that that's 1.4. All right, this would go in the sharps. And I will put on my new needle and get this labeled to confirm that this is ceftriaxone, 0.5 grams. Okay. We're going to get her cyanoclimbalesmin 200 micrograms, and we have available is 1,000 micrograms per milliliter. Okay, so we're going to need my calculator again, sorry. Okay, so 200 divided by 1,000. It is 0.2, and that's multiplied per 1 milliliter, so that will be 0.2 milliliters. All right, confirm that with that math with my second nurse. She says it's cool, it's good to go. Okay, so we're going to, before I fully open that up, we're going to check that it's cyanocobalamin, 1,000 milligrams, that's my correct available, and I'm gonna check expiration and clean this top. Throw that away, get my needle and syringe ready. And I would not touch the top of the needle and make sure that's sterile the whole time. Okay. And I'm going to get 0.2. One, two, three, four. Okay, so I'm gonna confirm that with my second nurse. I'm gonna show you that that's 0.2. Yeah, I cleaned it, confirming my cyanocobalamin expiration date. Okay. I would have it up before then. Okay. Okay, I can confirm that with my nurse at 0.2. Confirm with you at best. It's yellow because I used a different needle and practicing. Okay. Alright, so we can put safety on and put that in the sharps container, but for my purposes, I'm gonna keep it and put on a new needle. Alright. Now my TB, because this is my old one, and my TB is here. I'm looking at the expiration and noting and confirming with the nurse that the usual dose for tuberculin test is 0.1 milliliters. Okay, so I will get my tuberculin syringe. I will draw back at 0.1 milliliters. Confirm that with my nurse, and I can confirm it with you here. And again, confirm that this is my tuberculin expiration, and I've confirmed with my nurse. Okay, going to administer that air, draw back up. Okay, I need to practice that, putting it up and then taking it out. Okay, and I can now recap that and being sterile that the needle doesn't touch the table. Okay, confirm that with my second nurse, and I can confirm with it with you here. Okay. I'd also like to reiterate everything that I would reassure or assure that I do during my medication administration. I'm assuring that I look at my medication before I get it with the MAR, once I get it out and confirming it with the MAR, and then my third time is confirming with the MAR at the patient's bedside. I'm also confirming each time the expiration and confirming that I have the correct available medication needed to give to my patient, and I'm confirming my medications with my second nurse every time. And especially for my high alert medications such as my insulin. Alright, so at this time we're going to stop and we'll get prepared to administer the medication to my patient.